RCM Innovators. I'm stoked to have you in this chair. I was thinking about the fact that you guys are in Naples, which I don't know that anyone recognizes as this bastion of innovation, but you were actually just telling me about an organization that's in Naples that is in fact like an Apple-level innovator that you guys are partnered with. Can you start us off with that?
Well, good morning. Yes, a really exciting company in Naples called Arthrex. They refer to themselves as the Apple of orthopedics. They're doing some really innovative things.
Yeah.
They've got the largest cadaver lab in America. They train over 10,000 surgeons a year, and we've developed a great relationship with them. We really would like to learn from them on how to innovate more quickly around healthcare.
Sure. So they have disciplines in innovation, everything from how to find innovative people to how to foster their innovation, etc. What have you learned from them so far?
Well, we've learned that you just have to try things and either fail or succeed a little more quickly than we're used to in healthcare.
Yeah.
And their whole mindset is around problem solving.
Okay.
They see a problem, they just try to solve it. They're not rigid in their approach to things. They're, I would say, fluid in their approach to things, but always solving other problems.
I get you. One of the issues that I see is happening for like brick and mortar healthcare providers is that it's difficult for them to attract these stellar innovators into their organizations. There's kind of we talked about this, a brain drain of sorts that's happening. A lot of vendors, exciting technologies. This group that you were just talking about in Naples, a good example. Ooh, that's a very attractive place to spend my career kind of thing. Have you learned about ways, and I'm sure in Naples even more difficult because it's not exactly this is where the up-and-comers are at, right? Have you learned about ways to attract innovative individuals to a health system?
You know, I think what we're trying to do now is ask workers how they want to do the work, number one. Number two, what kind of work excites them. So we're out recruiting now more, not to a position, but we're going after the kind of people you're talking about.
Yeah. And if you get somebody into the organization that has that zhuzh, what are ways that you can set them up for success?
Well, we have formed a part of our company called the Performance Management Office.
Okay.
And so it's a group of people that really are out to solve problems and accelerate solutions. And we find that these young people who are good problem solvers, like you're describing, we sort of put them into that group and let them pick out the projects they'd like to work on. It really seems to be working.
I see. So they get to identify the challenges that they find compelling.
Yes.
They're excited about solving these issues, and I imagine you resource them somehow. You give them the time and space to succeed.
Yes.
What do you set them up with in terms of expectations? How do they know they're succeeding?
Well, we have some great project management people in that team.
Okay.
So we identify the metrics and the outcomes we're really looking for.
Yeah.
So one of them, just to quickly, I was on the phone before I came here to talk to you, was around surgery. We've got turnover times in the operating room as a metric we really want to improve upon. We want to reduce complications. So we list out the must-haves and then let these smart young people go tackle the project.
I get you. Cool. And they're excited to do it, I'm sure.
Very much so.
Yeah, right on. It's cool to tackle fresh problems, right?
Yeah.
So let's kind of zoom out, and we're looking at healthcare now at the 30,000-foot level. There's been deteriorating margins, it's been a real problem, staffing an issue, a lot of pressures, an increased need to innovate, I'm sure, and then the interchange between payers and providers becoming an increasingly challenged dynamic, right? I've heard people describe this as sort of an arms race, and in this room here, these are the arms dealers. What are some of the suggestions that you have for health system leaders to survive in this really challenging time? What are some of the tactics you guys have used?
Well, and you and I were talking about this a little bit. You know, we've talked about payment for value now for a decade. It really hasn't materialized. No. We still are being paid pretty much the same way we always have been. It's a pay per click. It's a pay per admission for the most part.
Yeah.
What we're doing is trying to get back to the basics of getting waste out of the system. So when we reduce length of stay, we're reducing waste. When we reduce readmissions, we're taking waste out. So we look at all the things that add cost but not value.
So we've heard from Becker's that there's some enormous number, $260 billion worth of waste, which they attribute to administrative costs, administrative waste. Wow, that's a lot. What are some of the ways that you're seeing success in eliminating that type of waste?
couple different things, but one of the things that we're trying to do is work on partnerships now. So innovative partnerships, as an example, we just partnered with Nicholas Children's Hospital, the #1 pediatric hospital in the state. And so we had been doing pediatrics on our own up until a couple of months ago. Partnering with a #1 player in the state and one of the top 5 in America really gets you there quicker in terms of figuring out what works and what doesn't.
Yeah, that makes a ton of sense. So I want to pull the thread on partnering, but I want to ask you about partnering in terms of the vendor space, right? You guys, I know you have services partnerships. I don't know if you have technology partnerships, so I want to hear about that. But I also want to hear about what guidance you have for health system leaders for making partnerships work, right? I mean, there's ways to come after, there's probably strategies to make them successful. What are some of the strategies you folks have used to make your partnerships work?
Well, we've got 2 big ones that we formed this year. One is with ProScan, which is a national imaging company, and the partnership with them made us the #1 provider of imaging in both the inpatient and the outpatient, which we weren't big in before, but #1 in both of those in the Southwest Florida market. So we quickly that's a win. And they have a lot of technologies, a lot of artificial intelligence in their system that we've now incorporated.
Okay.
The second big partnership we just announced last week is with the Hospital for Special Surgery. That's the #1 orthopedic hospital in the world for more than a decade. So they're going to come to Southwest Florida and teach us how best to do orthopedic care.
Wow. Okay. Powerful partnerships. So when you're leaning into a partnership with a vendor, there's obviously costs involved, there's time, there's risk, there's all these things. What are some of the strategies that you guys use to really ensure you're getting success, the ROI is happening, et cetera? How do you do that?
Well, we look real heavily at the track record of the company we want to partner with. So Ensemble would be a good, we talked about that. Ensemble, we think, is the #1 rev cycle company in the country. We went and talked to their clients. I don't think to this day have lost a client. They just don't lose clients. Their metrics are powerful. The second thing after the metrics we look at is the culture.
Okay.
We spend a lot of time with the leaders of these companies, including like HSS and ProScan.
Sure.
We want to make sure there's a cultural fit, because that's going to be the glue that holds it together. We really aren't into transactions as much as we are true cultural partnerships to get these things working.
This actually sounds like a really powerful piece, so I want to unpack it a little bit more. What does it look like when you're in the process of getting a read on a cultural fit?
Well, for the HSS, the Hospital for Special Surgery, we made multiple trips to Manhattan and New York to visit with their doctors, visit with their leadership team, sit in on a couple of their meetings. And we had vetted out a couple of other potential partners the same way, and there just wasn't that same fit or the same chemistry that we could find.
Yeah, so this is aligned on kind of purpose. This is aligned on the way that they think about people and staff and that type of thing. So you're really looking for a connection on those areas. Is that what it is?
It truly is. And our board has been since I started about 3 years ago, our board is made up of very high performing ex-CEOs, successful people. Their mantra has always been, my top 3 priorities are quality, quality, quality.
Yeah, and when you look to partner, that's the philosophy that you're looking to partner on.
That's the lens we're looking through.
That makes a lot of sense. So I'm sure, as you guys have been clearly aggressively innovating now, there's risk in doing that, and there's challenges that you've encountered, pitfalls that you've probably met along the way. As other health system leaders look to kind of follow in the footsteps of some of the things you've talked about here, maybe you can give them a preview of pitfalls that they're likely to encounter and perhaps ways to avoid them.
Well, I would say the biggest thing we've learned in forming some powerful partnerships is if you want to do it right, it does take a little bit of time. It definitely takes a lot of involvement from the top leadership of the organizations on both sides. I don't think you can delegate strategic partnerships. I think it's really the top level leaders at both organizations coming together. Yeah,
that makes a lot of sense. Where are you looking to find out the next opportunities that you want to be pursuing in terms of technologies and innovations?
Well, one of our big initiatives is to ease of access to the patient. So we're looking for technologies that make it so easy. And again, going back to Apple, we think of nowadays everything that's done through the iPhone, but yet healthcare has been slow to adapt that. We'd like to find technologies like that that make it easy for a patient to navigate the whole system.
I get you. It sounds like, at least from what you've described so far, that when you're looking at these new initiatives, you have an inclination to be partnering for a lot of these. Are there other initiatives that you've undertaken that you've decided to go with an in-house build of sorts?
There is. We're building the Naples Heart Institute.
Okay.
So it's the Heart, Vascular, and Stroke service line.
Oh, okay.
And on that one, we went out and just recruited what we think is one of the best cardiologists in the country.
Okay.
Came from a top 10 program in America. He is the leader, and he is attracting like-minded doctors to the initiative. For right now, we're just doing that one on our own because we believe that we have the talent now to get that done.
When you're evaluating whether to go in-house or out-house, outsource for the solutions that you're looking for, how do you go about that decision making?
Well, that's a discussion we have a lot with our board, and we really look at what are the capital requirements, how quickly can we do it on our own, would it be better to partner faster, and would it save us capital to do it, and finally, as I said, number one, will it impact the quality either way with the partnership? And
you guys use like an RFP process for all that work?
Yes.
So this idea that you can get there faster or not, the cost of time and money and that type of thing, I'm sure vendors would love to, all of them tell you, oh, there's no way you can. Right. But how do you really get to the realities of that? Because everybody's saying they're the best, they're the fastest, there's no way you can beat us in-house, et cetera. That sounds like a very difficult kind of a reality to navigate. How do you approach it?
I don't know that we have a simple solution to it, but we do a lot of homework around our potential partners. And again, we take site visits, we talk to past clients, we do a lot of due diligence on our potential partnerships. Yeah,
so the guidance that it sounds like you would have for health system leaders is really the same thing, right? So do the visits, really find the cultural alignment, get in touch with the clients that they've been working with, understand how well they've been performing, et cetera. I'm sure everybody has their favorite clients they would love to hand you. Do you ever try to dig a little bit deeper?
We do.
Do you?
We try to go to the unanticipated places to see how it's working.
And how do you, so you looking at news reports to figure out who they may have partnered with that they didn't hand you in their prepackaged group of please call these folks for referrals?
And we try to really tap into our frontline caregivers too. We have about 1,100 physicians on staff at NCH who have connections all over the United States. We really tap into our medical community to get their opinion too.
Yep. Yeah, I understand. So a lot of technology coming. We did talk about that there's been some challenges around the automation space, and delivery, et cetera, but are there automations that you folks are looking at in either the clinical or the back office side?
We're on the clinical side, we're looking at some artificial intelligence to identify potential length of stay outliers early on. There's some interesting technology coming in on that. And we're also looking at some technologies for patients coming into the hospital in the emergency department, early warning system type of technology.
Is this like stuff you're aiming at for 2023?
Yes.
Yeah. I heard about a technology at this show actually that is identifying disengaged clinical staff, right? People who are like approaching that kind of burnout, like this person may be about to step away from their role. Can you intervene like quickly? And they're looking at patterns in I don't know actually all the patterns that they're looking at, but certainly in their attendance and the ways that they're engaging in their work, that type of thing. So it's interesting to think that we can identify that and get ahead of it. Are you guys having trouble with the staffing side? Because I'm hearing this is just sort of a national issue.
Well, that's across the United States, but we just did a Gallup engagement survey of our 5,000 employees, and one of the most interesting findings was kind of different than what I've seen in my past, is that our employees, their number one thing that came out wasn't about pay and benefits. They want to know the why behind what we're doing. And it struck me in reading these engagement surveys, we haven't done a good enough job with our own employees telling them why we're taking the actions that we are taking. So we're going to spend a lot more time and money this upcoming year to personally talk to groups of our employees to make sure they understand the why behind what we're doing.
That's really powerful. This idea of purpose being an element in business seems to be kind of an emerging, it's almost like in the same area that you have benefits, like salary benefits and purpose is becoming this powerful third category. So you're going to increase communications internally, visibility for your initiatives, that type of thing, and explain. So if you were to describe the top level purpose of your organization, what's the one sentence on that?
Well, we say that we're in existence to help people live longer, healthier, and happier lives. So we want to provide care that makes people happy while they're living a longer life. And I think that what's not to like about that?
Yeah, a powerful purpose to be a part of, right? At a human level, you're meeting important human needs.
Yes.
So it sounds like the connect that you're trying to make is, well, with this initiative and the partnership that we're doing with that vendor and the clinic that we're opening in this way, you're trying to create that story that ties those initiatives underneath that main header of your purpose. Is that how it's looking?
It's true, and I think we can impact our region, our state, and ultimately our country by providing care that does just what I said, makes people happier than they were, healthier, and live longer. I mean, that's what we're all about.
What do you think it is that's causing purpose to emerge as such an important aspect of people's work recently?
Well, I think this pandemic was certainly a key piece of it. I mean, we dehumanized people in many ways by all the masks and the PPE, which may have been necessary, but we lost an important connection to each other through that. And I think people are hungry to get back to the human connection.
Yeah, it's almost like you can't see that you've lost it until you take a pause and step away and kind of like, wow, this has been different and I'm missing something. I'm looking for it. And you've heard of the quiet quitting, I'm sure. Do you think that purpose and quiet quitting have any kind of a correlation?
I do. And, just about 2 weeks ago, the New England Journal of Medicine had a report in there that talked about first-year medical residents. These are young people that have gone through medical school. They're now practicing their craft as a resident. They are 5 times more likely to be diagnosed with depression than the average person. And you think about that, and I think a lot of that has to do with their training through those 4 years with the pandemic. They lost track of the purpose, the human interaction.
Yeah, that's a huge change.
Is that
Wow. So we're talking about huge changes, but in a gear switching kind of a way. Before we rolled tape, so to speak, we were talking about Amazon, Walgreens, CVS, Apple, all very innovative technology companies kind of jockeying for their share of the landscape in healthcare. Brick and mortar, looking to innovate in ways that can kind of compete with this reality. What does that look like from your lens, from your seat, as you see these large, whether they're tech players or they're definitely consumer-facing organizations making their plays into healthcare? What does that look like from your chair?
Yeah, it's an uncertain thing, isn't it? But I think what we're trying to do is look for vendors in any space to be partners, not vendors. And I was talking about Ensemble. I think they, as a company, have a mindset that they're out to make my organization successful.
I get you.
They're not narrowly focused on rev cycle.
Right.
That's their, you know what I mean? So I think companies that come at it from that point of view are going to be the winning healthcare companies, and they're the ones that we're going to want to innovate with.
Yeah, so what you're looking at is that they have that ability to go the mile deep in these specialized areas. You partner with them, you guys stay focused on the clinical side, really getting your energies around the patient care directly, and where specialization is required to handle things like machine learning, robotic process automation, analytics, etc. Ensemble has the focus on that side, and you're relying on them.
Yes.
Is that right?
And because we think in the future, I mean, hospitals are going to essentially be huge ICUs, right? The sickest people are going to be in the bricks and mortar.
Yes.
Most of the other things will be remote or in settings that are non-hospital settings.
Yeah. What other areas do you see that have been classically in-house of the hospitals and health systems that you think are going to start to move more to the specialized vendors who can go that mile deep?
Well, there's some interesting, when you think about different kinds of rehabilitation, whether it's cardiac rehabilitation or physical rehabilitation, you sort of start thinking that there could be technologies like Peloton where you could have patients exercising and working out and doing things through some type of device like that.
Yeah.
Get them out of an expensive hospital setting into their home, into a gym. I think that'll be the next thing we start to see.
What is that? IoT, Internet of Things, right?
Yes, yes.
So you start to get more sensors in the house and telehealth, taking advantage of all the different devices that these people are interacting with to get a comprehensive record of health.
Right.
One of the things that's been a challenge in that space is the sharing of information, right? So PHI and all the lockdowns for consumer protections, et cetera, appropriately protected, but it does create challenges. Where do you guys see that there's a hang up that you'd love to break through that would allow you to achieve more in terms of patient health, where the information isn't quite being exchanged the way you would hope for it to be exchanged?
You know, I don't have the answer to that, but we just switched to Epic, which is the country's leading electronic health record that will allow us to do a lot more sharing back and forth with other health systems.
Sure.
But I think one of the roles that's going to emerge here, or a team of people, would be clinical people that can help patients understand that interchange between, say, Mayo Clinic and NCH. There's got to be, I think, a human in there to help translate all this clinical data to the patient.
I see what you're saying, because the patient isn't qualified at the level.
Right.
Right. So we have to break it down and make it something that they can probably interact with on their phone.
So
perhaps.
the data is interoperable, but
Yep.
but the understanding sometimes isn't. There's a translation factor in it.
You know, so as I observed the attempts that we were seeing in the kind of the political sphere to address things like surprise billing and the proposed legislations that were coming out, it's like I think that they're really lacking the depth of understanding necessary to address this issue in the right ways.
Yes.
And you're creating really weird situations where price gaming and other things like this can take place between health systems as they try to just attract patients based on a dollar figure, which is the wrong way to make this happen. When you were observing kind of how our political sphere was attempting to address things like surprise billing, what were you seeing?
Well, I think that we as a hospital industry are going to have to get a little bit more active in educating our patients about what are the different health plans. What's the difference between Medicare Advantage and traditional Medicare?
Yep.
Because the surprise billing is really just out-of-network billing. The patient didn't really understand that they were signed up for a network.
Yeah.
Right? And you know, ACOs are kind of confusing too, because patients don't really understand what's going on in the back. I ran an ACO, and patients don't understand how those things work at all, and there is really no network to those.
Yeah.
So we have to do a better job of upfront telling people, hey, you probably would be best off signing up for one of these kind of plans or not.
Yeah. So it seems like if we're just touching on the political thing for a second here, we are right on the midterms right now. What is it that you're seeing in that space that you think is going to be important for U.S. healthcare providers to be paying attention to, aware of, maybe reacting to at this time?
Boy, that's a tough question. But I mean, the finances of healthcare in the United States are really in dire straits.
Yes.
So I think we've all got to get active in the political process and really spell out, you know, Americans, I mean, the latest polls say that they think that the government should be providing more benefits in terms of health care. The question is, how do we pay for it? So I think we'll have to get much more involved in the conversation.
So what I'm seeing, if you look at like HFMA best practice benchmarks, the MAP keys, I'm seeing that over the last 2 years, some of the key indicators, lagging indicators, I'll acknowledge that, of the performance and revenue cycle have been going backwards. So we've actually seen a pretty significant increase in denial rates is a really good example. And I know that there's some thought that this is pandemic related, et cetera, but they have persisted, even though I feel we're largely past the major impacts of the pandemic. You can share your thoughts on that. What are you seeing? Are you seeing that we're really slipping in terms of the major performance indicators of revenue cycle performance, or has it been stable? Are you seeing improvement? What's that looking like from your seat?
Well, ours actually has gotten a little bit better in this last year, and I attribute that to the fact that we've gone to Epic and we've got a partnership with Ensemble where their billing process is a little more clear than the average. So I think that the reason you're seeing the slippage is there's massive confusion. Patients don't understand the bills. They don't understand where the bills are coming from. They don't know that they've gotten the service. And the co-pays and deductibles are much higher than they have been, so the out-of-pockets are a bigger issue than they used to be.
I appreciate those thoughts. This has been the conversation I was hoping for, but I have one more thing that I just kind of want to open up here, which is, as you know, we're just in this conversation, the RCM Innovators conversation, to create a mind share for health system leaders to understand how is innovation taking place in other health systems, what are they doing, how are they finding the wins. I've been driving this conversation with my own questions. Is there a question that I didn't ask you, that I should have asked you, that would allow you to share some other insights that you may have for other health system leaders looking for your guidance on how they can pursue innovation?
Well, thanks for the conversation. The one thing that we think a lot about right now, we don't have it figured out, but a question would be that I'd love to hear you cover sometime in the future. How will the care model change? I mean, the care model in healthcare in America really hasn't. It's been a doctor and a patient in an exam room. It's been a hospitalist taking care of a patient in the hospital. I think we're going to have to get much better at team-based healthcare, where nursing, physician assistants, nurse practitioners, physicians, all those people come together somehow to manage the care of that patient, not 100, that patient.
That's a beautiful vision. I really hope it comes true. Thank you for taking time with us today. I appreciate you sharing your thoughts.
Thank you.
Thank you so much.